Hi, everyone, and thanks for joining us. Oh, here we go. Okay. Um, so my name is Jacqueline Plant, and I'm a community program coordinator with Olympic Community of Health, or OCH. We also have Lauren Garrett on the line from OCH. She's a community program specialist, and she is kind of our tech expert, which we'll be referencing quite a bit today, and she'll also be giving a demo on that later in the call. So today we're going to be going over a new funding opportunity from OCH for local health serving organizations and tribes to join our region's community care hub, which is Olympic Connect, as care coordination partners. So we'll walk through some details of the opportunity together. I'm going to kind of comb through the RFA a little bit. Person in. We'll go through kind of the purpose, the scope of work, eligibility requirements, contracting and onboarding, and the application process. And then Lauren's going to give a quick demo of our shared regional technology, Connect2 Coordinator, just to give you an idea of what that looks like. It's our client management system, and that's what you would be using to manage cases as a contracted partner. And then we'll have plenty of time for questions. So I'll pause and ask for questions after we review the RFA. And again, at the end of the session, and you're also welcome to drop any questions in the chat throughout the session. I don't think it'll take the full hour. We left plenty of time for questions, so we'll try to get through this fairly quickly. And then lastly, I just wanted to mention that we are recording this session. I think I hopefully already have it going. And we'll be posting the recording on our YouTube channel tomorrow for anyone who can't join us live. All right, so let's get into it. Give me 1 second. I'm gonna just start sharing my screen. Share screen. Okay, so hopefully you can see I just have the funding opportunities on the OCH website pulled up. So this is the opportunity that we're talking about. It's the Olympic Connect Care Coordination Partner funding opportunity. And I'm just going to open up the full RFA, which is here. And I can zoom in a little bit if that's helpful. Do it like that. Okay, so I am going to jump around a little bit here. Hopefully that's not annoying, but I'm going to skip over the purpose for a minute and just briefly go over a little bit of background on OCH and what Olympic Connect is first. So we'll start here. So OCH is a nonprofit organization serving the Olympic region, meaning Clallam, Jefferson, and Kitsap counties, as well as the 7 sovereign tribal nations of the region. We're one of Washington's 9 accountable communities of health, and we were first established back in 2017 under a statewide project to look at how we can better serve community members who are on Medicaid. So our goal is to improve individual and population health and to advance equity by addressing the determinants of health. Olympic Connect, right here. Olympic Connect is a service of OCH or a program that was recently launched, actually just at the end of 2024, so still relatively new. Olympic Connect is a community care hub. And Olympic Connect is really what this opportunity is specific to. So we currently have 12 contracted care coordination partners throughout the region who are working directly with clients to connect them with the vital services that they're in need of. So things like childcare and transportation, employment, housing, you name it. We also actually very recently contracted with 3 new referral partners who are set up in Connect2 Coordinator, our shared platform, to receive referrals from Olympic Connect care coordinators to their specific resources and services directly. So we have a few food banks and a behavioral health counseling service. We're dedicated to continuing to expand the social care network that is Olympic Connect, which is what we're doing here today. So This care coordination partner expansion is a really, really exciting opportunity as we've been asked over and over by several different organizations and clinics and tribes how they can be a part of Olympic Connect. And this is a really big step toward our vision of this unified network of partners that are seamlessly connecting people to the support that they need to thrive. And it's an excellent way for any health serving organization who is already doing work of this nature to continue doing so, but within the infrastructure of this established hub and in coordination with other entities. Okay, so let's go back up to the purpose and overview. So OCH is inviting organizations with an established foundation in community-based care coordination to partner through the Olympic Connect program. This unique opportunity is designed for health-serving partners in Clallam, Jefferson, and Kitsap who are already working to identify and address social needs. So rather than funding the creation of new programs or paying for individual services, this one-time capacity building opportunity provides the technological infrastructure, standardized workflows, and regional network support to enhance and scale existing community-based care coordination efforts. By connecting current community-based care coordination efforts into the Olympic Connect infrastructure, partners can collectively strengthen regional support networks, contribute to and capture regional data for future sustainability, and ensure no community member slips through the cracks. So you may have noticed the use of the phrases established foundation, already working, existing community-based care coordination, which may sound a little redundant, but we really wanted to emphasize that this opportunity is a little different than the existing care coordination partner relationships and contracts that we have now. So with this new type of partnership, we really want to bring on teams who are already doing this work on their own and would really benefit from continuing their work amongst a unified network with a shared infrastructure and with access to this shared regional technology to manage cases and client information and simplified closed loop referrals. We track all of that in the technology, secure messaging, and client documentation. And the tracking of client outcomes. So the benefit of this partnership for Olympic Connect is that we're able to expand our reach and our impact. We're able to expand the level of coordinated care that our community is receiving, and it enables us to collect more of that valuable regional data, which is really vital for continued funding and advocacy efforts. Okay, so what does this all mean? So let's go down to the scope of work. Let me zoom out a little bit here. Okay, so we're asking organizations and tribes who are already providing community-based care coordination services to integrate the Olympic Connect framework. So we get you set up on our client management platform, Connect to Coordinator, or we call it C2C sometimes, which you would use to document client information and needs, case notes, resource referrals. And then I just want to point out up here the community-based worker, because care coordinators, and I know I've used that phrase several times, but they go by many titles like case managers, resource navigators, et cetera. In general, we typically refer to the folks doing this work and working directly with clients in this capacity as community-based workers or CBWs. So if I say that, or you see that pop up in the RFA, that's what we're talking about. Okay, so on this column, we have kind of the leadership or supervisor role and then the CBW on the second column. So for supervisors, we're just asking them to oversee and champion the integration of Olympic Connect policies and procedures, the use of Connect to Coordinator with their staff, and just to maintain general oversight throughout the contract period, to keep an open feedback loop with OCH, as this is all relatively new and we're all learning as we go. It's a completely collaborative effort. We'd also like for you to host a virtual partner presentation where you can share about your organization and the work that you're doing, so we can really socialize you amongst the network and our other care coordination partners. And then for the community-based workers or the CBWs, those are the ones that are really working directly with the clients. So first, they would participate in an Olympic Connect onboarding where we can get them trained on the Olympic Connect policies and procedures and how to use the technology to document cases. They would be kind of the primary point of contact with the client And then they would utilize Connect2 Coordinator for secure case documentation. They would be referring and connecting clients to resources and services based on the client's needs and goals. We always say Olympic Connect is client-led, so it's really just whatever the client is in need of and wants to prioritize at that time. And then they would be documenting everything in the platform, which Lauren will kind of give you a demo for shortly to show you what that looks like. Okay, and then let's skip ahead again a little bit to role of Olympic Community of Health, OCH. So generally speaking, OCH is providing that backbone infrastructure of Olympic Connect, which means we do a lot of marketing and community engagement and storytelling around Olympic Connect. We currently have a campaign called Voices of Olympic Connect, where we're kind of collecting editorial stories of client success stories or CPW success stories and sharing them on our website and with potential funders. We manage all of the funding. We're maintaining the policies and procedures, quality improvement, as well as advocacy for the shared technology that we're all using. So when we find things that we want to change or bugs or things that aren't working well, we have a direct line of communication with the stewards of the technology, and we raise those issues. We provide the contract monitoring and technical assistance, as well as continuous expansion of the social care network, which is why we keep kind of bringing up these opportunities to bring more partners on. The more people that we have working together, the stronger our network is. And then we do a lot of workforce development as well. The community-based worker onboarding, convenings, and network opportunities. We host a lot of trainings and events, virtual and in person. So let's go back up to eligibility. So in order to be eligible to apply, you just must be an established legal entity within the region that's working to advance health in some capacity. You must be in good financial standing. And really this opportunity is open to any type of entity, health providers, tribes, civic institutions, community-based organizations. The critical requirement here really is that we just really want you to be already established in providing some type of care coordination or resource navigation service. So ideally, you're already kind of serving clients. We wouldn't really be assigning you new clients from outside of the stream of work that you already have. Okay, so just to point out geographic distribution. So once again, we're kind of looking for partners in all corners of the Olympic region. And so when we're making choices, decisions about who to bring on, we're really trying to capture partners all over and make sure that we have an equal distribution of partners. Okay, and then for the compensation for this, so this funding is just a one-time capacity building payment. It's $10,000. It'll be paid within 30 days of when your contract is executed. We're really not anticipating that this partnership or this contract to require much of a lift beyond that initial onboarding and getting set up on the platform, which is why it's just a one-time payment. Because again, we just want you to continue the work that you're doing, but within this infrastructure and within this network. And then for the timeline, so we're on this second item right now, the info session. We'll be posting the recording of the session by the end of this week. Applications are due by 5 p.m. on Monday, the 24th. And then we'll be reaching out to applicants by September 1st on regarding the status of their application. And then from there, we'll be conducting a 30-minute virtual interview, which we'll send the questions for ahead of time. And then the final partner selections will be announced on September 23rd. After that, we'll go into contracting. which kind of just takes however long it takes in onboarding. Once your contract has been executed, we'll get you and or whatever the team members are that are doing this work signed up for one of our monthly in-person onboarding sessions. They're typically like a full day, like 9 to 4 with lunch, and we host them at our office in Port Hadlock. Um, okay, so this is kind of the application and interview scoring and evaluation process. So this is what we're looking for when we're making these decisions. So again, there are two phases of this application process. One is just completing the application. It's pretty short. And then there's the interview. So the scoring criteria, which is here, every item, yeah, randomly every item on this list begins with a C. The application is pretty brief, so you can see that we're only looking for a few of these items on the application with the intention that we'll kind of cover the rest during the interview. So you can see what we're looking for with each item in that evaluation. And then, yeah, any questions on this process? We do have an FAQ document. It's a Google Doc that's linked in this document that we've been updating regularly as we get any questions. If there's any questions during this call, we'll add them there. Or you can always email us at connect@olympic.ch.org and we'll get back to you within a day or two. And then contract requirements. So pretty basic stuff here, but prior to contracting, we'll just be checking to make sure that you're not debarred or suspended. We'll ask for your proof of insurance coverage. We'll ask for a W-9, as well as your banking information so we can do your payment through ACH. We will just ask that you keep us updated on your staff. So if there's any turnover or new staff, we can make sure that we're updating their user permissions and or removing users that are no longer there and getting anyone trained up that needs to be trained. We'll ask that you use that cloud-based software, the Connect2 coordinator, in adherence to the privacy and security policies. And that you adhere to the Olympic Connect policy manual, which is linked here. Okay, and we've kind of already gone over the application process, but you can see the application by just clicking this link. It'll open it up for you. It's just a Word document. You can fill it out and email it to us at connect@olympic.ch, due on the 24th. We'll reach out to you by September 1st. And then we have a block of days for that 30-minute virtual interview. So we'll coordinate with you on a good time for that. We would send the questions 3 days in advance, and then final selections will be made, or you'll be notified by the 20th. Okay, so I think that those are the main things on the RFA. Before I hand it over to Lauren, just wanted to pause and see if there were any questions on the RFA. Okay, cool. I'm going to stop sharing, Lauren, and then do you want to share your screen?
Yeah, thanks, Jacqueline. So I'm going to be giving you all a quick tour of Connect2 Coordinator, or C2C, is what we call it for short. It's used by Olympic Connect Care coordinators to manage their caseloads and document their clients' journey. So this is where we track demographics, social and health needs of community members, resources to referrals. It's also used to extract, the data that we share with care coordination partners. It's how we learn more about our region's needs, and it's also how we report to our funders. So let's go ahead and take a look at the platform. And I am logged in as a care coordinator here. So the first thing you see is called the program dashboard. And this gives you at a glance how many cases you have open, how many tasks are due or open, and how many clients you're serving. To the left, you can see this navigation bar, and we have a section where you can search clients. You can also search by case. You can see your assigned tasks here and active tasks for your overall organization, which again gives you a good idea of where your organization is at in working with your clients. There's a secure messaging platform that works similarly to email. And this is the training environment, so none of the information you're seeing is PHI or anything like that. There's also a chat function, which is secure as well, and you can use this to communicate with any other Connect2 coordinator user. And then we have our resource directory here, and if you've been to the Olympic Connect website, our resource directory on there is fed by our Connect2 coordinator resource directory. So right now it's at, I think, around 800 resources and growing every day. So I'm going to give you a tour of a client profile. When you're working with a client, from the client profile, you can see at the top you have at a glance all of their pertinent information. We store things like spoken language, preferred name, contact information, address, household information, insurance, demographics. And then you can see below that there's a section for flags, and this is a quick way to look at what this client has already said they needed based on their assessment. Below that, you can see if there's any open referrals to resources for this client, so it gives you an idea of what they've already connected to or what they're in the process of working on. You can see any assessments that they've had done, whether it's a needs assessment or a discharge. And then you can also see open cases that they have. You can see any previous tasks that were completed or tasks that are currently open. Any documented contacts with the client. There's also a place to save attachments. So this is helpful if you're trying to connect a client to a resource, maybe they need income verification. You can upload it here and store it securely in the Connect2 coordinator platform. And then there's also a section for messages and your case notes. So that's the client profile view, and we'll take a look at the case view. So this test client has an active case, and we can see I'm the case manager here listed for this client. If we look over here, we can see if there's any client care team members that have been recorded. So this test client has their primary care doctor listed, which is a good way to store information for who you might be coordinating with when you're working with a client who they're already engaged with, whether it's primary care or maybe another care coordinator at another organization. Below that, you can see the tasks that are assigned to you. And the standard workflow for care coordination probably doesn't feel very different from how you already serve clients. It's outreach, assessment, setting goals, recording referrals to resources, and then an ongoing progress update until the client's ready to discharge. So again, you can see their listed referrals. You can see ones that are open. You can see ones that have already been made, so it gives you, it's a good history of what the client has already been connected to. And if there are any messages specific to this case, they would appear here. And same with attachments. So that's a very quick overview of the Connect2 coordinator system. I'm happy to answer any questions that you all might have, but that's what the system looks like at a glance.
Lauren, any more questions on platform or this opportunity? There was a question about where to find that document that I was going through. It is linked on our website, and I linked to it in the chat as well. All right. Well, if nothing else, as I mentioned, please feel free to email us at connect@olympic.ch.org. If any questions do come up, Lauren or I are happy to answer. We'll keep our FAQ updated. And yeah, hopefully look forward to hearing from some of you. And thanks so much for listening in.